First we start the basics, that is the fracture. So what is fracture? Fracture is the break in the continuity of continuity of a bone. Fracture, it's the wide spectrum term. It covers all the fracture. Fracture can be open or closed. Fracture can be simple. Fracture can be compound. There is any vascular or nerve involvement. Fracture can be multifragmentary if we talk about geometry, or segmental, or if fracture with bone loss. Fracture can be described in terms of various characteristics. Fracture can be described in terms of a number of characteristics. Based on etiology. Fracture can be traumatic, it can be pathological, or it can be iatrogenic. If we talk about morphology, so in morphology, we talk about the fracture pattern. Then comes the severity of the fracture. Severity of the fracture, either the involvement of soft tissue or a joint, or associated with any neurovascular structure, degree of comminution at the fracture site. Then it can be based on location, which part of the bone is affected. Then displacement of the fragment. Displacement of bony fragments with each other. So there are various characteristics which we have just seen. Then comes the etiology. If we discuss them in particular, first we discuss the etiology. So first one is traumatic fracture. Any trauma, road traffic accident, either slip and fall or fall from height. The trauma can be direct blow to the bone or indirect violence to the bone. Other etiology, pathological. In pathology, that is abnormal bone which gets fractured. So abnormal bone can be single bone or can be systemic involvement of the bones. Systemic involvement seen in osteoporosis, osteomalacia, in children, rickets. Other in osteogenesis in children, osteogenesis imperfecta, and in metabolic conditions like renal osteodystrophy, And there is one term called insufficiency fracture. That is also a pathological fracture, but these are mostly considered the safe relative to their prevalence. The most commonly seen in osteoporosis, insufficiency, osteoporosis, and osteomalacia. Osteomalacia. In osteoporosis, there is a progressive bone loss, which lead to decrease bone mineral density, which decrease bone mineral density, or you can say deterioration, deterioration of deterioration of in bone micro architecture, deterioration of the micro architecture. The common sites which involves in pathology, common sites which involves in pathology and osteoporosis are hip bones, hip में nego femur, IT femur, wrist में Colles fracture, proximal humerus or dorsal spine. Have wedge compression fractures. Wedge compression fracture. In osteomalacia, other term is osteomalacia. There is a bone softening. There is a bone softening. Bone softening due to bone softening due to defective bone mineralization. Bone mineralization. The most common cause is, what is most common cause? The most common cause is vitamin D deficiency. The vitamin D deficiency is so prevalent, mostly why? Because of more and more indoor activities. It is wearing burqa. Other, it can be because of excessive alcohol intake or in case of renal disease. Then comes the fatigue fracture or stress fracture. Based on etiology, fatigue or stress fracture. These fractures results from these fracture results from cyclical cyclical application of cyclical application of cyclical application of stress on the normal bone with excessive frequency. These seen in change in the change in level of intensity of activity. The fatigue fracture are seen mostly second metatarsal of army recruits, also called march fracture. Also, new long distance runners. The fatigue fracture, it can be incomplete or linear fracture. The investigation of choice for the fatigue fracture or stress fracture is MRI or bone scan. Then the based on morphology, based on morphology, based on morphology, one is transverse fracture. Transverse fracture. This one is this bone is the normal bone. This bone is the normal bone. If we get fractured like this is the transverse fracture. Then there is the application of bending force or direct blow. Direct blow to the bone. If the force impact is high, there can be comminution of the fracture site or multi-fragment. These multi-fragment or butterfly fragment like this, it occurs on tension side of the bone. Of the bone. Then comes the spiral fracture. Spiral fracture. Spiral fracture caused by indirect rotational forces. The mechanism of injury is simple twist or fall or sporting activities or accident. Then comes the avulsion fracture. Avulsion fracture it is caused by the traction from a ligament or tendon or joint capsule. The avulsion fracture caused by traction from a ligament, tendon, or a joint capsule. Joint capsule insertion site. The most common sites are anterior, inferior, iliac spine. Avulsion. Which muscle is attached at the anterior inferior iliac spine is rectus femoris and kicking the wall. Other side is other side of avulsion, the base of fifth metatarsal, because there is a muscle called peroneus brevis. It's attached at the base of fifth metatarsal due to avulsion fracture. Other one is impaction fracture. Impaction fracture when bone fails in compression lead to impaction fracture. These are seen at tibial plateau, humerus, or neck of femur. Valgus impactions are common. Calcaneum in case of fall from height. Fall from height. In the spine is seen at the dorsum of dorsal spine. The wedge compression fracture. Then we discuss the severity of fracture. Severity of fracture. Severity of fracture. Severity of fracture defined by the fracture is either open or closed. If the fracture is open, there is chances of infection in bone. Infection leads to acute osteomyelitis or chronic osteomyelitis. If the fracture is involving intra-articular area, then the chances of arthritis if the fracture is not reduced anatomically. Comminution at the fracture site. Comminution at the fracture site can lead to limb length discrepancy or chances of non-union. If the fracture associated with dislocation of joint, and the chances of arthritis at the joint. So there is a two term called either either dislocation. One is subluxation. In dislocation, there is a complete loss of congruity between articular surface. In subluxation, there is a loss of congruity, but the two surfaces are still in contact. In dislocation, like this one is knee joint, femur, and the tibia. If there is anterior knee joint dislocation, but in subluxation, they are still in contact with incongruity of joint surface based on the location. In children, if the fracture involving physis or not. In adult, which part of the bone is involved, metaphysis or diaphysis? Because metaphysis has a cancellous bone. It can lead to depression of fracture fragment, depression of articular surface, and their complication. In the diaphysis, there is a cortical bone. Then there is a junction of metadiaphyseal junction, which is vulnerable to fracture. Then comes the displacement. The displacement described in terms of length, either the length is maintained or not, whether there is a distraction of fracture fragment or shortening of the fracture limb. If there is a angulation with reference to apex of the fracture, angulation leads to valgus and the varus deformity. Check for the rotation based observed externally, not on X-ray. The limb externally rotated or internally rotated, as seen in IT femur and the necrofemur. The translation of distal fragment. Translation with respect to proximal fragment, either anterior translation, posterior translation, medial, lateral, or posterolateral. Which type of displacement is there? So, in general fracture general fracture discussion. So, the general concept of fracture is discussed. In the further video, we'll discuss each and every topic of the traumatology. Then we discuss the cold orthopedics. Thank you.